Using the right mobility aid can reduce the risk of falling, reduce pain, compensate for neurological impairment, and improve confidence. Unfortunately, some of these aids are acquired through informal sources without seeking advice from a health professional. As a general rule, the larger the mobility aid, the more stable it becomes. However, the trade-off is walking speed and access to different environments, which is often reduced. Forearm support frames, or gutter frames, are a larger frame which allows the user to take the weight through their forearm. They are usually height adjustable and can have either 4 wheels or 2 front wheels and 2 rear skis. This frame is more stable and is used when maximum weight relief or support is required, such as after a hip or pelvic fracture. Due to its larger size, it lacks manoeuvrability, and therefore it is often not used in the home setting. It is suitable for patients who are unable to take weight through their wrists and hands. For example, people with rheumatoid arthritis of the hands who cannot grasp handles of frames, or people with wrist fractures who also require the use of mobility frames. With shoulders relaxed and 90 degrees bent at the elbows, the gutters of the frame should rest under the forearm. In this position, the person should be able to push down through their forearms to provide some lift. The gutters can be rotated for comfort. Stand upright and establish good balance. Push the frame forward while taking as much weight as is appropriate through the forearms. It is important to stay within its base of support. Do not pull on the frame to stand or sit, as the frame can tip over. Ensure that the gutters are at a correct height. A frame that is too low may cause the user to bend forwards unnecessarily. A frame that is too high may make it more difficult for the user to take weight through their arms. It is also important not to lean too far forwards or backwards, as this may affect your balance and ability to progress off this frame at a later stage. As the back wheels or skis extend further back than other frames, it may not fit under chairs or beds. If this occurs, do not sit down when the frame does not move back any further. It's important to keep walking back until the chair or bed can be felt behind the legs before sitting down. Ensure the person releases their hands from the handles and brings arms down to the side of the frame and then back to the chair or bed before sitting. Mobility equipment must be inspected for signs of wear and tear. Always check for signs of bending, deformity, breakage or corrosion. Protruding or missing screws, split or loose hand grips, worn rubber tips, the safe user weight limit sticker. Always wear well-fitting footwear with non-slip soles. No thongs, loose slippers or socks. When outdoors, take care on wet or uneven surfaces. Frames should not be used on stairs. When prescribing a mobility aid in the home, check for and eliminate any trip hazards such as loose rugs, power cords or cluttered furniture. If the person using the mobility aid has stronger leg strength in one leg, turn toward the stronger side to provide more support. Where possible, these aids should all be prescribed by a trained health professional, such as a physiotherapist or occupational therapist. For more information, contact your local hospital physiotherapy department. Other options in the community may include private providers, local pharmacies, or local health equipment suppliers.